Welcome everyone. Are you ready to ace your OET reading test? Imagine confidently understanding every medical term that comes your way. Today we'll explore powerful strategies to build your medical vocabulary and master your OET reading from anatomy to pathology, treatment procedures, and beyond. Let's get started. Let's focus on the four key areas to boost your score. So these are the key vocabulary areas for OET reading. The first one is anatomy. So as healthcare professionals, you're already well versed with the structure and functions of the human body. For the OET reading, it's crucial to reinforce this foundational knowledge, ensuring you can quickly identify anatomical terms in clinical contexts. Whether it's the cardiovascular, respiratory, or nervous system, understanding precise terms of organs, what are the precise terms for each thing, such as organs or for tissues and their functions, will streamline your ability to interpret medical documents efficiently. And when it comes to pathology, diseases, symptoms, and diagnosis, because it's all about the pathological knowledge is at the heart of medical practice, right? So it allows you to diagnose, treat, and manage diseases. When reading medical texts for OET, focus on recognizing key pathological terms and their context. Terms related to common conditions, sometimes it can be acute, chronic, and diagnosis will often appear in clinical scenarios. So, being familiar with them ensures you quickly assess and understand the medical conditions being described in patient histories or case studies. The next one is the treatment modalities. Your ability to recognize and understand treatment modalities, whether it's pharmacological or non pharmacological, is essential for interpreting medical literature. This could involve everything from the administration of specific medications, the rationale behind different therapeutic approaches, or the details of diagnostic and therapeutic procedures. Understanding the terminology related to interventions will enable you to quickly digest treatment plans and recommendations within OET reading text. So, clinical instructions, when it comes to clinical instructions, it forms a critical part of medical communication, and you're likely already using those terms on daily basis. In the context of OET reading, understanding the precise meaning and usage of terms like monitor, where you are tracking patient progress, and the word that you use for giving medications or interventions, we say administer, and notify, the word which you use for alerting your colleagues or patient. These are vital for interpreting professional communication, right? So mastery of these terms helps you navigate procedural instructions or medical directives effectively within your clinical documents. Let's see how to build your vocabulary using various strategies. As medical professionals, you are likely familiar with medical terminology, but when encountering an unfamiliar word, the surrounding context can help you infer its meaning, right? For instance, if you come across a term like tachypnea, in a clinical passage, and the sentence reads like this: the patient exhibits tachypnea with a rapid rate of 30 breaths per minute and shallow breathing. You can deduce that tachypnea relates to an abnormal increase in the rate of breathing due to the context provided by the description of rapid and shallow breathing. So you need to look how the word is used within the sentence and the general tone of the surrounding information in order to make a guess about its meaning. And make use of medical dictionaries. For precise and accurate understanding, specialized medical dictionaries or glossaries are invaluable. These resources provide definitions which are tailored to the medical field, ensuring you fully grasp technical terms. For example, if you come across a term like hypertrophic cardiomyopathy in a text and aren't entirely sure of its full definition, a medical dictionary would explain it as a condition where the heart muscle becomes abnormally thick, potentially obstructing blood flow. So always keep a trusted medical dictionary, either digital or physical, when reading clinical text to quickly clarify the meaning of unfamiliar terms. The next one is root words. You need to learn the building blocks of medical terms. So, medical terms are often made up of root words, prefixes, and suffixes that provide clues about their meaning. Understanding common medical roots will help you break down complex terms. For example, cardi, if you take the word cardi, it refers to the heart. So, cardiologist, heart doctor, cardiomyopathy, heart muscle disease. These are words you can understand if you are familiar with the root word cardi, right? Same applies to derm. Derm refers to the skin. So, words like dermatitis, inflammation of the skin, or epidermis, the outer layer of the skin, will make more sense once you will recognize the root. Now I'm going to tell you how to make your vocabulary stick. So you need to organize your terms, your words by body systems or diseases or treatments. You can categorize your words based on different types. It can be by body systems, it can be by diseases or treatments. So, this categorizing medical terms makes it easier to recall and connect related concepts. Organize your vocabulary by areas such as body systems. Example, it can be cardiovascular or respiratory, or it can be by diseases or conditions like diabetes, pneumonia, or through treatment modalities like pharmacology, surgery, right? So, this approach helps you mentally organize terms and reinforces their meanings in context. If you are learning about heart or the words related to heart, arteries, veins, hypertension, so that comes under a category of cardiovascular system. And about lungs, bronchitis, asthma, oxygen ventilation comes under respiratory system. If you're learning about the words like insulin, glucose, hyperglycemia, type 1 diabetes, all these comes under diabetes. So when you encounter a new term, think about which category it belongs to and how it relates to other terms in that category. So it will be easy for you to create a word families. Word families, like are groups of related words that share a common root, right? So identifying these categories, you can build word families also. So these families helps you understand many related terms at once, and it can improve to recall what we have discussed earlier about the cardi, right? Cardiac, relating to the heart, cardiologist, a heart doctor, cardiopathy, heart disease, right? So this focus on learning root words will help you build words around a specific context or a specific category. And then later, you need to aim for at least 7 to 8 words a day. Consistency is a key. Review your list every week to reinforce your learning. Consistent practice is essential for retaining new vocabulary. You need to aim to learn at least 7 to 8 new words each day, whether from your clinical practice or from OET preparation materials. So it depends on your materials or your practice, but at least 7 to 8 words a day. And at the end of the week, you need to review your vocabulary list to reinforce what you have learned and ensure the terms to stay fresh in your memory. That's all for today's session. If you have any queries, please do drop them in the comments. I'm happy to assist you. Do share, like, and subscribe for more OET related tips. Thank you. Have a great day. Bye bye.